Hello and welcome to Inside Edition, where we discuss national, regional and international issues in depth. The vast spread of COVID-19 pandemic caught much of the international community off guard. However, the Kingdom of Bahrain enacted an early prevention and preparation phase with various procedures and decisions to deal with COVID-19 and ensure the health and safety of its people and residents. The recently launched national vaccination campaign comes in line with those efforts, marking another story of success in terms of combating the spread of COVID-19 and decreasing its impacts on both individuals and the society. To know more about the campaign, we are pleased to be joined here in the studio by the Consultant Public Health and Epidemiology and Head of Immunization Group, Dr. Basma Mahmoud Al-Saffar, right after this. Welcome back to the studio. We are joined here in the studio by Dr. Basma Mahmoud Al-Saffar. Thank you for being with us today.
Thank you. Thank you for inviting me to this presentation about COVID vaccination.
Yes. Doctor, over the past months, let's say, a lot of questions have arisen about the vaccinations. Everybody is glad that they are here, but there are many choices to be made, and a lot of people are figuratively questioning the vaccines just for their own sake. They want to know what they are getting. So today, this is an actual talk where we clarify all of the pointers that people had. First of all, COVID-19 has affected not just the Kingdom of Bahrain, but the world in general. And the vaccination came in as a rescue mission that is an ongoing rescue mission for everybody to get inoculated and to get vaccinated. What can you tell us about the figures in Bahrain now when it comes to vaccinations?
So, since the start of the pandemic, the Kingdom of Bahrain has taken the responsibility to maintain the health of the society and the community in the Kingdom of Bahrain. And a lot of proactive measures has been taken, including the case detection and cases isolation and testing. And with them also, when they start the vaccination campaign and the availability of vaccine of all of different types of vaccines that's available under emergency authorization. And thanks to God and also His Majesty the King, who was the first to announce that the vaccines is free for the Bahrainis and also the residents in the Kingdom of Bahrain. And that was a great achievement to get all the population to be vaccinated. So around more than 200,000 has been vaccinated with dose 2, which is 2 doses completed of COVID-19 vaccine, and more than 400,000 completed dose 1 of COVID-19.
That's a very good number, especially when we look at the person per capita of the Kingdom of Bahrain.
Yes.
Bahrain has really risen in the ranks when it comes to vaccination, as well as it has risen in its preventative measures when it came to actually taking care of the patients that did have COVID, finding and tracking the patients that got in contact together. Bahrain was actually internationally recognized because of these pointers. We remember that at the beginning of the pandemic, within a few days, if not weeks, if not days, COVID centers were initiated in parking lots and hospitals all over the place, and we had so much capacity, we didn't have that much COVID patients. And that has always been a very satisfying and a very comforting thought when it comes to the Bahrain's reaction to COVID. What can you tell us about that reaction?
So the Kingdom of Bahrain started early, since the start of the cases occurrence in China, and that's why they were ready with a national task force and all the instructions by His Highness the Prime Minister, Prince Salman bin Hamad Al Khalifa, and all the teams has been organized in order to combat the pandemic, and all the steps has been taken since the start. The early case detection, testing centers, and special dedicated places for case management, and including ICU places with all the equipment available, including ventilators. And later on, when the vaccination started, Bahrain was the first to introduce the clinical trials and also the vaccination in the kingdom.
Absolutely, all very satisfying milestones that have been reached. So, what can you tell us about the importance of the national vaccination campaign, and why should everyone register to get vaccinated?
So the vaccination campaign is very important because, as you all know, the vaccination is an important preventive strategy in preventing diseases, especially the pandemics. And since decades, the vaccines was used to combat pandemics, and many diseases has been reduced, eliminated, eradicated because of vaccination. And that's the situation of COVID. COVID affected our lives, affected it from all aspects, social, financial, psychological, from all aspects. We are at home, we cannot visit our friends, we cannot let our children to go to school, and that was disappointing. So we need to find a solution. The solution for pandemic and the way to get rid of it and to combat it is to have a vaccine. And the vaccination is very important and to prevent the spread of the disease. And I hope that the community engagement is more. And this is what we rely on, the community trust and engagement in taking the vaccine, which will end this pandemic.
Yes. Absolutely. I mean, when it comes to getting vaccinated, as you have said, vaccination is a lifelong, there's so much history when it comes to vaccination and inoculation, different types of vaccination. And what Bahrain has done, it has provided several types of vaccination for everybody to basically look at what they feel more comfortable with. And for those who did not get vaccinated, something else is available, and so on. And that's what we want to talk about in our next question. We hear a lot about dead virus vaccination. We hear a lot about inoculated vaccines. We hear a lot about mRNA vaccines. What types of vaccines does Bahrain have? And can you tell us a little bit about the differences?
So as we all know that vaccines are of different types, and it's not a new strategy. It has been used from decades, as I said. Yes. It has been used for children, for adults, and this is for many diseases. For COVID-19, there was a lot of efforts by the manufacturer to produce vaccines, and there are different technologies used. So the first one of them, and the most traditional, is to have the virus inactivated, and then treated with certain chemical to be inactivated to induce immunity. And that's the inactivated SARS-CoV-2 from one company. Then we had a new technology, which is the messenger RNA, that will encode the part of the virus and will stimulate the immune system to produce antibodies. And this is in a simple way how it works. It goes at the level of the cell, but not at the level of the nucleus. So it will not change in the DNA, it will not change in anything in the genes of the individual, but it will induce immunity. The third type is a viral vector, and that has been used before as well in Ebola. And this is a technology where they use another virus to carry only the protein S to stimulate also the immune system against COVID. And there are two types, and probably the third type is coming of the viral vector vaccine. So Bahrain is pioneer in this, introduced all type of vaccine after studying them, after having all the documents checked by the National Health Regulatory Authority to ensure its efficacy and safety. And then introduced under emergency authorization.
When it comes to basically choosing these vaccines, are there any kind of specific choices when it comes to people who have chronic diseases, people that are within a certain age, and what does the ministry provide in order to help people make this decision?
Yeah, I mean, the choices is available. All the vaccines are available. The target group is priority to be the elderly population, those with underlying medical condition. Certain contraindication when it comes to the content of the vaccine, when it comes to allergy to a component of the vaccine, that will be the only limitation to take this type of vaccine. Anyway, all the vaccines are available. They can choose whatever they like. If they want the traditional technology, if they want the new technology, the efficacy is variable. Some having 79 efficacy, 79%, some will be higher efficacy, but the safety profile is good for all of them. So the choice is they can make it themselves, but all of them, when introduced in the kingdom, they have been studied to make sure they are good and effective and safe as well.
One of the things that we want to point out, of course, as a medical professional, you look at the details that come behind the names of the vaccines. But a lot of our viewers know the vaccines by their actual names and don't really relate about the medical intuitions on it. But just to make things clear, the available vaccines in Bahrain are Pfizer BioNTech, that is the mRNA vaccine. We also have the Sinopharm vaccine, which is the inactivated vaccine. We have the Sputnik 5 as well as Covishield. and both of these are the
Viral
vectors.
Yes, exactly.
There is a vaccine that was announced early on that it will come to Bahrain hopefully soon, which is the Johnson & Johnson vaccination. And we just want to know from you, when it comes to these choices and everything, what should people do in order to get more information about it?
They can visit the link of the Ministry of Health and also the platform dedicated for checking and registering for the vaccination, and they can know some information about the type of vaccine. And when they come to the vaccination center, when they choose the vaccine, further information will be provided to them as well.
Yes. And at this point, I also want to focus on something very important that people don't know, because we are behind the scenes, is that on a weekly and sometimes in several days, there are always updates from the vaccination center for the medical staff, whether nurses or doctors, if there are anything new coming up, or if the study has shown anything new. How do you update the health professionals now?
We had a regular meeting, we had a regular virtual presentation with them when there is an update, when there is any change in the literature, when the new studies are coming and the new recommendation, and we are updating the healthcare worker from private and governmental health sector in order to be updated according to all the information in this regard.
Yes.
And because they are frontliner and they are in direct contact with the people and they are trusted by the community.
Right.
So they must be equipped with the good knowledge and to know and to answer the inquiries of people.
Absolutely. I totally see the point of that, especially that because of these weekly meetings, they have the answers that people ask, which we're going to get into. What are the procedures to get the vaccine, and what are the common side effects of the vaccine? You actually train the nurses and the doctors to answer these questions, but from you, what are the procedures to get the vaccine, and what are the common side effects of the vaccine?
The procedure is very simple. We have the Be Aware application, the phone application that they can register through it with certain basic information of the individual, and then when they have the appointment, they will go to the vaccination center dedicated for vaccination, whether it is their local health center or another vaccination center, which is many places, exhibition center, King Hamad University Hospital for one vaccine, which is Pfizer vaccine, and also we have newly the Citra Mall for vaccination, and this is really excellent effort from the government to have many places, and this is to cover a lot of people at the same time. We want to get them protected earlier, and when they register and get the vaccine, they can have some of the side effect, which is it's normal, and not all the vaccines will be 100% without side effect. And we have to tell the truth that some side effect will happen like other vaccines, local reaction like pain, injection site pain, and also redness, swelling can occur. Systemic reaction, which is common with fever, body pain, muscle pain, and this will happen 1 to 2 days post-vaccination. They can take analgesic, or if it is get worse or severe, they can go to their local health center to consult and report the cases. And until now, with all the followed cases post-vaccination, we did not get any serious reaction post-vaccination, which could be related to vaccine. So we are monitoring the cases to reassure the people that nothing serious happened until now post-vaccination.
Yes, and even the questions that you guys have tailored for the nurses and doctors to ask before vaccinating actually target these kind of allergies.
Yes, of course. They have to ask screening question to make sure the individual is fit for vaccination. And this is to ensure his safety, because safety is important as well as protection. So we ensure that the individual fit for vaccination by certain question regarding his condition today, if he had COVID before, and if his condition is stable to get the vaccine or not.
Right.
Or if he had history of allergy.
Yes. In addition to that, some people are very bad historians. So you even take that into recommendation and into consideration, and you ask the people to wait after they take the vaccine for a period of time, right?
Yes. For certain people who had reported a history of allergy of certain medications like injectable medication or certain vaccination or to a component of the vaccine, totally contraindicated like to take the vaccine, but certain condition we give the vaccine and we let them to sit for 30 minutes to observe them. And we had many people who sit under observation and we don't have any reaction happen.
But all bases are covered.
Yeah.
Well, Next question, when it comes to the awareness that you spread among healthcare workers, is that vaccines are safe and effective. And a lot of people say that, or thought at one point that the vaccinations were not available and that's why they were given other vaccines and so on. What can you tell us? Were these vaccines actually expedited? Did the manufacturer expedite the production of them?
So for all vaccines to be produced, there are certain phases of the clinical trial to be followed. And it passed through many phases, from phase 1 until phase 3. And this is the story of COVID vaccine. It started from phase 1 and phase 2 in the country of production. And then in phase 3, they went to other countries and they tested it on a larger number of population. And Bahrain was one of them in inactivated vaccine. And through this trial, they tested first the safety of this vaccine on limited number of individuals, and then they increased the number in phase 2 to test the safety and efficacy, and in phase 3 on a larger population to also ensure the safety of the vaccine as well as the efficacy. So because the efforts has been towards manufacturing these vaccines, the financial support is available from manufacturer, that's why it might be expedited this time, but it is passed through the same phases.
Right, right, absolutely. And now for me, the most important part that these clinical trials have really shown, and why these weekly Zoom meetings are important, there are always changes when it comes to population. For people to understand more, when we talk about population, a population is a group of people who something is where the vaccine is tested on. Yes. Within this population, there are other populations or subpopulations like pregnant women, previously COVID patient, as well as children and so on. And with the time passing by, we have noticed that certain vaccines were allowed now for pregnant women, certain vaccines were allowed for lactating women, and certain vaccines are allowed now for COVID patients that have already recovered, but in a different kind of dose. What can you tell us about this basically update?
So in general, the clinical trial, when it is started and done for individuals, it will include healthy individuals. Yeah. They will not include people who are at risk. So one of them is pregnant and lactating. They are excluded from the trial. Yeah. But in general, weighing benefit to risk, the COVID situation, when it comes to pregnant lady, it will be very severe. They might end up hospitalized, ICU admission, ventilator, and they might end up having preterm delivery. So in that case, and many vaccines have been already administered to pregnant lady in USA. The mRNA vaccine was given to thousands of pregnant lady. There was no serious reaction. So weighing benefit and risk, the decision has been taken to vaccinate pregnant lady after counseling them, and preferably not in the first trimester. They can take inactivated vaccine, which is what we have Sinopharm, and also the mRNA vaccine, Pfizer vaccine, and also the lactating, as the benefit outweighs the risk. Previously infected COVID patient, when they got the infection, they will have some level of antibodies, but this antibody level will wane with time. So they need to boost their immunity. They need to be protected with the doses recommended according to the type of vaccine. So also they can receive the vaccine, especially if they are high risk and healthcare worker.
Is vaccinating children something that is being looked into for the future?
Yes, because clinical trial started now for inactivated vaccine China. They started Sinopharm on children as well as Pfizer vaccine. In Bahrain, announced from 16 years also for the children to get the Pfizer vaccine.
Yes, definitely. And we've seen also a higher number of people that are coming in or registering for the Sinopharm vaccine, and all of the other ones as well, but because in healthcare centers we mostly see the Sinopharm and the Covishield, and a lot of people are registering their own children, whether 16 to 18 years old, to actually come get vaccinated. Next, we would like to know, how do you value the social awareness and support towards the efforts of the National Task Force for combating the coronavirus COVID-19 and the National Vaccination Campaign?
Okay, the efforts has been taken by the government and also the task force, and the community as a whole community, they have a great awareness towards the COVID-19 preventive strategies, and this has been shown and evident through noticeable participation in the clinical trial. We have seen a lot of people participated in the trial, and from Bahraini, from citizens in the Kingdom of Bahrain. And that's at the level of the trial. And then when the vaccination campaign was introduced, also they showed a tremendous trust toward vaccination. Many people register and they took the vaccine and protected earlier, and a lot is coming as well. So this shows the high awareness of the community towards the health services in the kingdom.
Yes. Doctor,
Is that answering your question?
it does. It does hit the target, but I really want to know, what do you think about how the people are interacting? I mean, early on, maybe mid-COVID crisis, in the middle, a lot of studies came out, whether it was from mental health institutions or people on social media campaigns that were asking, do you feel you are part of Team Bahrain when it comes to your awareness? So do you feel that people are actually looking for this information and they maybe policing the people around them or their communities?
I think the community has really engaged, especially at the beginning of the COVID. They were not into the situation, but when it comes to their beloved one get infected, when they see death of people from COVID, they really start to think about it, and also they started to implement all the protective measures. This is prior to the introduction of vaccination. And I mean, following the instruction released from the Ministry of Health and from the task force, national task force. But later on, when it comes to vaccination, they were hesitant at the beginning, but later on, a lot of people register and they took the vaccine.
Yes. When we look at the beginning of the COVID pandemic here in Bahrain, very quickly things came into effect. First, it was medical treatment was available. Second, actual companies came out that started making masks, and we already had a disinfection product company, but that was even upgraded and a bigger size. That's on the basically economic side, and as well as providing the sanitation equipment. PPE has always been available in our hospitals. We never had any kind of shortage like other countries have basically said. And the vaccines were made available. There was never a time where the country has at any point said, we don't have vaccines now, you guys are going to have to wait a few months. Everything has always been available. Yes. How important is this consistency when it comes to vaccinating the number of people that are in Bahrain or the people that are going out into the world, basically?
Okay, so I want to say thanks God and to our leadership in this country. As you stated, all the PPEs are available and proactively working to provide all the measures required for protection, including vaccination. Vaccines available since the start, with the first type of vaccine, which is the Sinopharm vaccine. It was in the clinical trial and then under emergency authorization and then authorized. And the other vaccines later on, all available step by step according to availability and the quantities to cover the community in the kingdom, and other vaccines are coming. So we are planning, and the country is providing all the support, and all the vaccines will be available, inshallah, to protect people.
Hopefully. When it comes to international recognition, we talked a little bit about it in the beginning, how Bahrain was recognized internationally for its efforts in combating COVID-19. How do you value this international recognition when it comes to Bahrain's efforts in dealing with the pandemic?
So the efforts of the Kingdom of Bahrain is obvious, and we had a lot of successful stories, and starting from having all the teams, as I said, dedicated for national task force for combating the COVID-19, and also having all the equipment, having all the measures to protect people, and ending up with having the clinical trial in the kingdom, and then the availability of different types of vaccine under emergency authorization to protect the population.
Yes, and Bahrain has been a template for other countries.
Yes, pioneer in this.
Yes, it has been. Dr. Basma Safar, you are the Consultant Public Health and Epidemiology and Head of Immunization Groups at the Ministry of Health. We would like to have an awareness message from you to the public. What should they do now in order to be in their safest position against COVID-19?
So I'd like to say at the end, thank you for this interview, and just to tell the public that it's very important to be protected at this stage. A protection of an individual is a protection of the whole community. We need your effort, we need your engagement. Without this sense of responsibility, without being vaccinated, we will not end this pandemic. I hope that everybody register and get vaccinated, because we are in a good hand. Thanks God to be part of this team, to be in this country.
Definitely. Thank you so much, and thank you for your efforts and your initiatives to keep us safe as well.
And thank you very much. Thank you.
And we would like to thank you, dear viewers, for watching us, and we will see you next week in another episode of Inside Edition.